This is a WECT Cape Fear Business Break.
Hello, I'm Megan Donahue. Dr. George Huffman is a neurosurgeon with us today from Atlantic Neurosurgical and Spine Specialist. Dr. Huffman, welcome back.
Thanks, Megan. Thanks for having me again.
I know we've talked about the back and lumbar spine, but I know you also work with necks and the cervical spine area. Tell us about some symptoms that people can identify if they are having neck problems.
Well, that's an excellent question. Patients may have neck pain. They may have pain, numbness, or tingling in their arms, weakness. They may have difficulty with their balance. All these types of things may point to something wrong in the cervical spine, possibly some compression of the spinal cord or nerves.
Okay. Well, if people are having these symptoms, what do you recommend?
Well, first I'd recommend that they follow up with their primary care provider. And the primary care provider is usually going to try some sort of conservative management, maybe some anti-inflammatory drugs, a little therapy, maybe some injections. If that doesn't resolve it, they'll typically move to some sort of imaging study like an X-ray or an MRI, and they may send them over to be evaluated from a neurosurgical standpoint by one of us.
Okay. Now, if it is possible that they will have to have surgical intervention, what are some options?
Well, there are quite a few. Sometimes we go from the back of the neck, sometimes we go from the front of the neck. The most common thing we do is go from the front of the neck, take the disc and the pressure off the nerve roots or the spinal cord, and infuse the bones together with hardware. There are other options such as artificial discs, and for some patients that may be the best option. Every treatment is individualized.
Okay, and then get more information by going to your website at atlanticneurosurgery.com.
For more details, go to healthfirst on WECT.com.